Hello, Awaken Beauties. This is Cassandra, your health, beauty, and CBD coach. I am live from Beauty Ecology, and I just wanted to do just a really quick debrief. I've been jumping into Beyond the Pill by Jolene Brighton, and she has written this book and just launched. And really, it's a 30-day program on how to heal the body after you've been on birth control. Now, someone that's been in the natural health and women's health industry for over 20 years and been doing natural hair care for over, I would say 15 years, I've noticed a very, very consistent pattern that has gone on with women, and specifically when it comes to hair loss. Now, her book, Jolene's book, is specifically on the fact that with over 100 million people that have been on 100 million women that have been on birth control, 60% of women take birth control for non-contraceptive reasons. So there's a lot of reasons why. I believe both financially and women that just don't know any better, women that are in pain or just want to have any kind of relief. And then obviously for contraceptive reasons as well. But a lot of the reasons that we take hormone modulators when we're women is because of PCOS or bad periods or wanting to get rid of acne. There's all kind of hosts of reasons why women get on birth control. That's besides the point. I wanted to just jump into just literally 2 to 3 pages. And I feel like this is a really, really hot subject that comes up in my salon chair a lot at Beauty Ecology is hair loss. And I think they say 60% of women will experience hair loss by the time that they're 40 years old. And so this is becoming younger and younger in what I'm witnessing behind the chair in women. And it's really kind of becoming an epidemic. And so Beyond the Pill with Jolene is not just a book for post birth control syndrome. But within the chapter, I just kind of wanted to roll out just a couple pieces that I think that would be really, really helpful for women. And first of all, why is your hair falling out? And I work with a lot of functional medicine practitioners within my practice at the salon, and I also have a really rich background in functional medicine. So I can usually kind of key in when a client comes in and kind of at least gear them in the right way of what practitioner to see and what kind of hair loss they're experiencing. Most of the time, it is a hormone dysregulation and it is a stress-reduced cortisol, adrenal imbalance. Now, keep in mind that our bodies produce a lot of different messengers, and the skin and the scalp is kind of the last resort that we get when we're using any kind of collagen or any kind of products that we're trying to get more energy to those exports. Our mitochondria is very busy, and unfortunately, that's the last area that we see relief. So, a couple key pieces in the book, and you'll find it on page 54, Beyond the Pill, is I just kind of wanted to name off. So if you have a pen or a paper, I just wanted to name off kind of some of the key areas when you go into a practitioner, and hopefully they're listening to you, the key tests that you would ask for. So one personal experience that I had is I had severe hair loss for a number of reasons, but I never had a CBC done. So she started off saying, get CBC done. That's a complete blood count test, and that's really going to pick up on your ferritin levels and your iron levels. And so the CBC ferritin blood test is when you're going to want to get the thyroid panel, which is going to be your TSH, your T4, T3, and free T3 and free T4, your antibodies, and those are going to be testing for celiac disease and gastrointestinal dysfunction. And then high sensitivity for the C-reactive proteins, and that's specifically going to be around inflammation, high inflammation markers, total and free testosterone, which would be your DHT. Now, this is the excess testosterone that we have in the body as women, that we will see male pattern balding. And that usually is around this region and just kind of that horseshoe. And that's a lot of that testosterone that's suffocating the scalp that's trying to get out, causes male pattern baldness. FSH and LH, estrogen and progesterone, your sex hormone binding globulin, cortisol and DHEA test, comprehensive metabolic panel. So that's really going to check for your liver, your electrolytes, seeing how well those are working. Your fasting insulin and your blood glucose, that is going to be a big indication of blood pressure and blood sugar, and then heavy metal testing, which can also cause issues. The key nutrients that you want to look for, that's very, very common, and I really agree with where Jolene is coming from on this perspective, is iron, B complex, lots of adaptogens to support the body and the hormone pathways, sal palmetto to help regulate the DHT levels, and then pumpkin seeds, essential fatty acids, freshly ground flaxseed, really, really great for chelating excess estrogen out as well. And then exercise, de-stress, and getting everything moving, and detoxification and getting the gut health really optimized is important. So I just thought that this was a really kind of a really quick overview on what she goes over in Beyond the Pill with Dr. Jolene Brighton. The key tests to look for, I know that there's a lot of those listed in there. If you can ask for at least 4 of them, I mean, I would probably say your CBC to check your ferritin and your iron, and then your thyroid panel and your cortisol panel, to me, would probably be your most important test to look for. So that's my real quick rundown on the post-birth control syndrome chapters in her book. Check it out. Thanks for listening. This is Cassandra, your health, beauty, and CBD coach.